Welcome to Lecture 3E in the series, where we will be looking at a practical guide on how to choose a TMF. Choosing a TMF can be a daunting task. You have the CFR, the Paris, and these are just to name a few. Sometimes we resort to the lucky dip method, where we put in our hand and we take out whatever comes out. The problem with that is you may randomly choose a framework that does not work for you. We want to be more scientific in our approach. Nielsen helps us by bringing structure to the TMFs. They are stratified into determinant frameworks, which consider what influences the outcomes, process models, which describe and or guide the translation from research to practice, and evaluation frameworks, which is concerned with what the outcomes are. Even though these add some clarity, it really doesn't guide on how to choose which one you use. Let's switch tack a bit and look at the decision-making process from the other end. The article by Peters does not consider TMFs explicitly. Instead, it considers implementation strategies, outcomes, influencers, and methods. What I want for us to do is to focus on the implementation question and then use that to map onto a TMF. The first question is to explore. It asks, what are the factors responsible for implementation of an intervention? Basically, the question is asking, what are the barriers and facilitators to the implementation of the intervention, which translates to what influences the outcome, which, as we said on the previous slide, maps onto the determinant framework. The second question is to describe. It asks, what describes the main factors influencing implementation in the context? This is also asking what are the barriers and facilitators to the implementation of the intervention, and hence it takes the same pathway as the one above. The third is to explain. It asks, how and why does implementation of the intervention lead to change? Basically, the question is asking, what is the process by which change occurs over time, which translates to what guides the translation from research to practice? I think you guessed it. That maps onto the process model. The fourth question is about influence. It asks, is coverage of a health intervention changing among beneficiaries? So is there a difference between the time points? That is, what are the outcomes compared to what we started? To assess that, we need an evaluation framework. I'm going to ask you to pause the video here and reflect on your research question. Which TMF category works best for you? So let's say you decided you needed a determinant framework. There are still a lot of choices. Should you use the CFR or the Paris? The one you choose is a very practical decision. Which one is a better fit for the question you want to answer? Which one are you comfortable using? Having said that, there is overlap between the frameworks. So let's say you are studying the implementation of a directly observed therapy. You may want to explore the impact of political will and that may have on your work. That would be covered by the outer setting in CFR and the context in Paris. You may ask, what evidence suggests that this intervention will work here? That will be covered under the innovations in CFR and the evidence in Paris. Lastly, you may want to consider if there is enough staffing and if your people are amenable to such an intervention. This will be explored under the individuals in CFR and the facilitators in Paris. Now it's your turn. Apply a similar approach to choosing among the process models and the evaluation frameworks. Which of these frameworks align with your research objectives? Pause the video here and have a go. Welcome back. Now let us explore what you may do if you have multiple aims covering explore, explain, and influence. Do you use one framework or multiple frameworks? My rule of thumb is to use one framework if it is possible. And again, this is for practical reasons. It's just less cumbersome that way. Sometimes it may not be possible, but with the expansion of frameworks to include multiple facets, this is becoming less of the case. For example, the updated CFR has added an evaluation element to its framework, and the pre-seed proceed model is also useful for measuring multiple concepts. Let's use the PRISM as an example, which has incorporated the REAIM, popular evaluation framework. Let's say you're studying the implementation of a community-based diabetes remission protocol. What are the determinants? Is there support from multiple sectors? Is your chosen community inclusive, or does it foster inequity? How do your implementation strategies support the process? Are you utilizing the expertise of community health advocates to improve acceptability? What outcomes do you want to measure? Acceptability of the approach or change in disease status? These can all be covered in one framework. So you may be tempted to ask, why should I use a TMF at all? If I am not subject to the framework, why not just measure whatever I want to measure? Here are some reasons I want you to consider. Number one, do it for the science. The more a framework is used, the more evidence is built around proving or disproving its usefulness in the field. Number two, it guides your evaluation. Sometimes researchers get to a junction where we need to report to the funders, and we're looking to see what data we have that we can report something. Using a TMF helps us to be more scientific in our approach, as what we will be evaluating and when we will be evaluating it is planned prior to the commencement of the project. Number three, it gives you ideas. You may have decided on what domains you want to explore. But when you choose a framework, you may be exposed to other domains within the framework that you might find useful to add to your research. This was by no means an exhaustive discourse, but I hope it was a useful guide on how to approach choosing a TMF. The key takeaways are, do use a framework. It is helpful on many different levels. Start with your research protocol and work towards the TMF, not the other way around. Your TMF, it should align with your aims and your objectives. Be practical. Use the one that is a better fit for your work and the one that your team has experience with. So the next time you are tempted to ask, which is the best framework to use, I hope you complete the sentence with, for the research proposal I have planned. Here are the references. I hope you found this useful.